And when Mark Carney says that the risk of a slowdown in economic growth, possibly a recession, if we end up exiting the EU, if Mark Carney is right, then that is a severe concern for the National Health Service, because it would be very dangerous if at precisely the moment the NHS is going to need extra funding, actually the economy goes into a tailspin and that funding is not there.
What would that mean in real terms for the NHS?
We've got a clear plan to improve cancer services, saving 30,000 lives over the next 5 years. We need to upgrade our mental health services. We need to strengthen primary care. In order to put the fuel in the tank, we will need the proceeds of economic growth. The truth, Andrew,
an
is
economic shock would actually put lives at risk. You wouldn't get the cancer care and so forth that you would otherwise be able to invest in.
It's been true for the 68 years of the NHS's history that when the British economy sneezes, the NHS catches a cold. And this would be a terrible moment for that to happen at precisely the time the NHS is going to need that extra investment. But from the NHS's perspective, it is pretty clear that the balance of the advantage is such that the risks would be greater were we to find ourselves in economic downturn, were we to find a number of our nurses and doctors contemplating leaving, and indeed if the pound were affected, because a lot of the drug treatments that we buy are priced in euros and dollars, so that could make it more difficult for us to get the treatments that we need at an affordable price.